Thanks a lot for the kind invitation. As you mentioned, I work in the Directorate General for Food and Safety, Health and Food Safety, Santé, in the European Commission. And today, as you mentioned, I will give you a brief outlook of the European Health Data Space and the AI Act and the correlations between the two, these two legislative instruments. Maybe I will start slightly one step. I will take one step backwards and indicate some of the global healthcare challenges that we face. And we know, for example, aging population, increase of chronic diseases. There is a lot of studies in these areas, healthcare workforce shortages, inequalities in accessibility, availability, and affordability of healthcare. And this is where what we say global healthcare challenges could be addressed, some of these challenges, through a digital transformation of healthcare. So now the question is, what do we mean by digital transformation of healthcare? Digital transformation of healthcare could entail two central components. One of them is the organization of health data in a country or at EU level. And secondly, another central component is the use of artificial intelligence. Let's start with the organization of health data. Going back to 2019, when we did a study in the Commission to find out if there was a problem with health data in Europe, what was the problem, and so on, we found several problems and issues. One of them was also misinterpretations and misapplications, I would say, of the GDPR. Sometimes health data were refused to be given, supposedly on GDPR reasons, despite that GDPR was saying the opposite. So there was a lot of unknowns. How do you collect data? How do you share them? How do you use them? How do you reuse them? And so on. And this is what led us to go for the European Health Data Space proposal, which, as you know, it was adopted a few weeks ago by the European Parliament, and it should come into force towards the end of this year, or maybe beginning of next year. But it should take a few more months to come into force. The European Health Data Space, as you know, and maybe I will just briefly explain a few stuff, but maybe you already know, is split into three main pillars. First, primary use of data. Primary use of data, we mainly refer to how an individual really or a healthcare professional could access data for primary care. In other words, someone using data for their own healthcare purposes. Of course, this one could very well connect with AI too, because if we're talking about digital transformation of healthcare, and you're talking about someone being, for example, in a remote village and wanting to access artificial intelligence, remote telemedicine, remote telemonitoring, and all these associated digital healthcare tools, of course, you should be able to have access to your data. If I'm in a small village, let's say somewhere, I should be able to have access to my data in order to transfer them, let's say, to a big metropolitan city, let's say a big university hospital in Paris, to be able to get the same treatment as someone who is living close to that big hospital. So the primary use of data, it also very much correlates to the ability of being able to use these tools, including artificial intelligence. Secondly, there is the second pillar concerns the electronic health record, which basically provides a CE marking for electronic health records, which in effect provides mainly interoperability. In other words, it ensures that electronic health records in Europe are interoperable. And this, of course, aids the primary use, because under the primary use, the individual has the right to access their data in digital format in an interoperable format, in a specific interoperable format, and that's how it will also enable this digital transformation of healthcare to take place. And finally, the third pillar concerns secondary use of data. With secondary use of data, here we refer, and I will get back to it in a couple of minutes, of how someone could access data for research, development, including AI. And I will get back to it in a minute. Now, with AI, one needs to create trust and acceptability of AI. Without creating trust and acceptability, AI would be challenged. It reminds me a bit of the COVID-19 vaccines. Unless you created trust and acceptability, they wouldn't be accepted. And I think, as I see it, it's a bit the same issue. And that's why the Commission came with, as you know, the first big legislative initiative, which was also adopted in 2024, and it should come into force in the next weeks, the AI Act. And I will get back to it in also a minute. Secondly, I also add here another legislative initiative, namely, which was also adopted a few weeks ago, and it should come into force in a few weeks, the Product Liability Directive. Sometimes we perceive the liability, especially in the product's liability, as being something which occurs or it will pop in after an accident occurs. However, the structure and the framework of product liability laws around the world also have an impact on how you develop the product. Of course, I can get back to it later if you want me to, but that's why I also add that one, because depending on the liability framework of the manufacturer, in addition to the obligations of the AI Act, might also do something extra because of its liability obligations. And will do that, of course, in order to avoid liability. So these two could be also well interlinked. Thirdly, issues concerning deployment. This is the third challenge about deployment. How do you transfer it basically from the shelf down to clinical practice? How do you take it to the hospital? How it is used in the clinical practice? How it is used in the ward? How it is trusted by the patients? How it is trusted by the clinicians? And now I will briefly say a few words on the AI Act, a few words on the secondary use, and a few words on deployment. Let's start with the AI Act. I'm sure you have all seen this pyramid. Of course, just to remind you that the AI Act is a horizontal piece of legislation, which means that it's not only applicable to healthcare. So for us in the area of healthcare, we would need to see the implications and interpret it in our specific domain of healthcare. But just to give you a very brief outlook, which you may already know, this is the famous pyramid that the Commission is showing very often. Basically, a very small part of unacceptable risks is a risk-based approach. So a very small part of an acceptable risk which is prohibited. On the other extreme, the green one, which is minimal or no risk, which is permitted with codes of conduct if they wish, and a high risk, which is that dark yellow thing there, which is mainly in the area of healthcare, we would be falling under that, under the high risk, I would say. And then there is some transparency risks, which includes, for example, a chatbot. Of course, if you have a chatbot in the hospital, you may also be subject to that. But I will get back to it in a minute. So let's see AI uses in healthcare now. AI uses in healthcare, there could be two main ways that you can be using AI in healthcare. Of course, there is several, but I will just, for the sake of clarity, limit it to two. First, you may have an artificial intelligence machine learning-based medical software, intended medical software, which is embedded in a medical device, or which is a standalone. Standalone, it means, for example, these decision support systems. So it's not connected to a medical device, but the standalone software itself is a medical device because it provides medical information to the physician, which the physician could, for example, rely on it and act upon that information. So this type of software, embedded or standalone, if they have intended medical purposes as defined in the medical devices regulation, then they would be most likely classified as 2A and above medical devices. If they're classified as 2A and above medical devices, it would mean that they would need to be subject to what we call third-party conformity assessment, in which case they would be complying and fulfilling the conditions in the AI Act, and this will render them high-risk AI systems. So they will fall into that part of the pyramid, which I told you that most of the medical devices, AI-based AI in healthcare would fall under. Now, if they fall under a high-risk AI system, it means the provider, the manufacturer, would be subject to certain obligations. So in a way, the manufacturer of the AI system, in addition to the medical devices obligations, would be also subject to extra additional requirements. Of course, if you see these requirements, I would even say there is nothing completely shocking there. It's requirements that a proper AI developer would have, I would say, more or less complied with. For example, just to give you an example without getting into everything, the data and data governance, there is the obligation that you're using data and you consider the different geographical, behavioral, functional, and contextual settings in which your algorithm is intended to be used. So in other words, just to put it simply, if you are training an algorithm on skin cancer and you trained it in Japan with Japanese data, if you want to lawfully market it in the EU, you should show that the algorithm is performing equally well on European data, in other words, on European skin, and you have also tested it, validated, and trained the algorithm in accordance with European data, health data. And this is where I will connect now this one in a minute with the European health data space to see the value of the European health data space in connection with the AI Act. And then there is some other obligations like human oversight, transparency, accuracy, robustness, and so on. Now, the second way, there is also obligations on the deployer. The deployer for us in the area of healthcare could be the hospital, could be the healthcare professional, which should assign human oversight. In other words, there is some human oversight of the AI systems. They are monitoring their operation. They keep automatically generated logs and so on. And plus AI literacy of their staff. Now, the second way that AI could be used is, I'm sure you have all heard of these general purpose AI models, which one part of these models, of course, I'm using the terminology used in the AI Act, which is general purpose AI model, but a part of these general purpose AI models could be what we call large language models, or maybe you're most familiar with the ChatGPT idea. Of course, it involves more than just that one, but just to give you some concrete examples you may be aware of. Now, these models now, they could be in principle further fine-tuned to become fit for healthcare. And once they become further fine-tuned, they could be incorporated into medical devices without me getting into the details, which will render the medical device maybe a general purpose AI system. So the model could be incorporated into a system. And just if you want to make it even more complicated, this system could be incorporated into another bigger system in the hospital, let's say. So as you can see there, the system provider would need some information, because if you are responsible for the medical device, if you do not have information on the model, on the general purpose AI model, most probably you wouldn't be able to comply with your obligations under the system. So you would need some type of information from the upstream provider in order to comply with your obligations if you're a downstream provider. And what are these obligations? Provider obligations include, and I would say the main one, it's the second one, I would say, the information to downstream providers. So you should provide, and it explains what type of information to the downstream providers in order to be able to comply with their obligations. Now, there was some question if it's free and open access models that you might be undermining innovation, if you're creating too many obstacles and so on. That's why there are certain exceptions for free and open source models. However, the AI Act also, and this wouldn't actually, the open and free open access, free and open source models would not be subject to this exception if they are general purpose AI systems with systemic risk. And actually the AI Act provides what a systemic risk is. So if you're dealing with such a model, then you will be complying with the obligations, the first group of obligations and the second group of obligations. So as we said, and going back into, as I said, it is important in the development of AI to have the right data. And maybe this is where the European health data space fits nicely also with encouraging innovation and also fit for purpose AI in the EU. And let me give you one of the scenarios. Of course, it's not the only scenario, but I will give you a bit one scenario which could be more familiar to healthcare. There is a data subject, which could be the patient, which goes to a hospital. Now, his data there are processed under normal GDPR rules because they are processed for his healthcare and you have a legal base in the GDPR to process this data. Now, this is what the European health data space would do. It will create an obligation to provide a description on what we call the health data access body. And there would be at least one in each member state. So if you're in France and you go to a hospital, you have data there, the hospital in France would be obliged to provide information of what data I hold. There is something also on data quality, but I will leave it for the minute. What types of data I hold in my hospital. So you're not transferring the data, but the description of the data. The French now health data access body would need to create a member state metadata catalog. Then this metadata catalog would need to be sent to the European Commission, in which case the European Commission will adopt an EU-wide metadata catalog. Now you have the researcher, the data user, who wants to use data, which, as we said, to do research, to train, validate, test its algorithm, her algorithm. Now, until now, actually, and this is what we also found, if this researcher was a small startup without any access to data, you may also remember it was said, it was very often referred to that there was no data, where am I going to find the data, and so on. So this is where you find the data. Then you send a data access application to the French data hub. If you want more data, your message could be sent to the other health data access body. You will get a data permit if you fulfill the obligations and the requirements. Then the data would be placed in a secure processing environment, so they wouldn't be sent to the researcher, but to the secure processing environment. You have access to it. Okay, let's leave these ones because I see time is running out. Then the data after 6 months would be deleted from the secure processing environment. So this is briefly what would happen and how I think it nicely connects with the AI Act. Now, the AI Act would enter into application in a gradual approach. I think maybe the most important for us in the area of healthcare is the last one, 36 months, which the high-risk AI rules would be applicable. Now, let me say a few words on my last 2-3 slides on deployment. What do we do in DG Santé on deployment? At the moment for 2024, so until Christmas, we have 3 running projects. One of them, together with the WHO the Euro area, not Euro only, which we carried out a survey on deployment of AI. It's been carried out by the WHO, but it's also funded by the European Commission. Then the second 2 other studies, which is our own studies, is one which is a study that we're now running, and I will get back into it in a minute. And also there is a grant under EU for Health in the Work Program 2024 that we will publish in September. And of course, I will explain a bit because you might be also interested in probably applying or forming a consortium and applying for this grant. Let me start with the study without getting into the details, because I see I'm running out of time. Actually, I have another 2 slides and I'm done. This study now, we basically aim to target hospital representatives, healthcare professionals, patients, AI developers, and AI in healthcare regulatory experts. So if you are a part of these stakeholders, in my last slide, I will give you a QR code. If you could please scan the QR code, you will enter our survey, which is carried out by our contractors, and then you can choose what it represents you, and you can fill the survey. That would be really helpful, so we get as many replies as we can, so we map a bit the whole of the EU as to what is the issue. And the issue may be mainly there is some simple questions or some questions from your own expertise as to the deployment. How do we accelerate the deployment of AI in healthcare, the safe and effective deployment? Now, this is my last slide. This is the program we have for 2024. You can even Google Work Program 2024 EU for Health and you will find it. Of course, it will be officially published in September. This is the number you can see now. It's a 4.5 million grant that will be given to the consortium or someone. So it could be private stakeholders plus member states. That could be, for example, a good combination or whatever combination. The aim is to accelerate the safe deployment of AI systems in clinical settings. So basically, we want to move now from the AI Act and the European Health Data Space to see AI being deployed in healthcare. It will create a community of experts at the EU level. It will establish good deployment practices for AI in healthcare at the EU level. It could also use the money for pilot projects. It would also create a digital tool whereby it will map where AI in Europe has been deployed and how. So think of a big digital dashboard having all the systems deployed in Europe. And then it will organize workshops and disseminate knowledge, as well as recommendations to the Commission. Thanks a lot. And if you could please scan, maybe, it's not yet live. It should get live within the next 10 days. But if you could please keep maybe somewhere this page, and when it becomes live in the next days, around a week, I think, if you could fill the questionnaire, we would be greatly appreciated. Thank you.